Mark, M-A-R-C, Moss, M-O-S-S. And I'm one of the intensive care doctors here at the University of Colorado Hospital. In the beginning, there was this sense of heroicism. This is why we went to medical school. These patients need our help. Some of the signs in the beginning that said, we love our healthcare workers, were really nice and comforting, and then those signs went away. You feel like saying, hey, we actually still have sick people in the hospital with this disease. They're scared. I think they get very scared. And they're afraid they might die. It causes what we call a viral pneumonia. And it's the way your body responds to the virus that causes the damage to the lung. In your lungs, you have a very thin membrane that separates where air is and blood is, and that's the way the oxygen gets into your blood. And when your immune system becomes over vigorous, that membrane starts to break down, so those air spaces fill with fluid. It's something called the Acute Respiratory Distress Syndrome. On the chest x-ray, air is supposed to be black. So in general, the lungs look black on a chest x-ray, but as fluid and cells fill those air spaces, they start to look white, and they white out their chest x-ray. You tell them what you're gonna do, and then you give them a sedative agent, and they fall asleep, and then you take a tube and you put it into their windpipe. Then that tube is hooked up to a machine, and that breathing machine or ventilator then does the work of breathing and pushes air into their lungs so the patient doesn't have to work to do the breathing. These are very sick people. It's somewhere in the 30 to 50% range. Unfortunately, people that get put on ventilators will die. I think sometimes it feels like a game of roulette, that you just can't always tell who's going to get better and who doesn't. Sometimes it just seems very random. Get people vaccinated. To me, it's very straightforward. And get people to understand this is real. And as I said before, it's scary.
It's a unique telling of that story from someone who's been there, but I think for most people through the pandemic, their view of COVID has been masks in places,
right,
and television coverage, not going into an ICU or seeing someone
right.
struggle to breathe so badly, or have someone in your family have to be intubated.
And that's why these healthcare workers, what they see and communicating with those families initially, where everybody was removed and they couldn't even speak to them other than, you know, through FaceTime and other things, what they've gone through. But to those families that have gone through this, they know what he's talking about, Dr. Moss, how incredibly serious and deadly it can be.
Yeah, you talk about that as well. You talk about the long term. There are many effects that this pandemic will leave behind, the burdens of families and children and things growing up in these different school years, but the psychological impact onto many people, including those right at the front line, is going to be something that will take years to manage as well.